Tragically, this has been the deadliest week of the pandemic so far in Australia. But for many of us, it's still difficult to fully comprehend the true extent of this disease. So tonight, the grim reality of what goes on in Melbourne's coronavirus wards. We're taking you right into the highly dangerous red zone at the Royal Melbourne Hospital, where extraordinary battles are being waged day and night. On one side, extremely brave doctors and nurses fighting to save the lives of their patients. On the other, the enemy, COVID-19. You're looking at a place you never want to see in real life. In the war against coronavirus, this is the front line. It's called the Red Zone.
There is a bit going on at the moment.
Short for Respiratory Emergency Department.
How far are they?
This is Victoria's oldest hospital, the Royal Melbourne.
And COVID unknown?
And for more than a century, it's never seen anything like this.
Her breathing rate has increased. My COVID positive patient in bed 2 trying to leave.
For the first time, they've agreed to allow cameras in.
Partner's also COVID positive but has been cleared.
To capture the confronting reality of this pandemic.
We're going to refer her to intensive care. It's an awful disease. There's no two ways about it. Every day we're seeing young people die.
And the danger here is obvious. Everyone must be covered head to toe in PPE, with COVID-19 literally floating in the air.
Today we've had lots of patients with coronavirus rolling in. It doesn't stop. No. The moment that you think you're just going to have a quiet day is the moment you know you're just going to have a busy day. So you just can't relax.
Can I take her ready to go? Or you,
which one?
Dr. Emma West and her team here are engaged in a daily battle against this virus that's brought Melbourne to its knees. I don't know why, but around the world, midday has become known as the witching hour for COVID-19, and it's the same here. That's when symptoms suddenly worsen for patients. And the ambulances, paramedics looking like something from Chernobyl, start streaming in.
Do you understand me? You understand a little bit? Yes. Poquito español. I think that's about all my Spanish.
24-year-old Colombian-born Jennifer Duque has been admitted straight into emergency's red zone, the first stop for all suspected COVID cases.
She'd come with shortness of breath and cough and chest pain and a very clear diagnosis of COVID, so COVID positive. So she came to the right area of the department, the red ED, and she had a really fast heart rate and she had a really fast breathing rate, and they're both worrying signs. You know, if I think about that patient when they're just coming in, I think, are they going to need to go on life support? Are they going to need to go on a ventilator? So we've already done some blood tests. You don't need oxygen at the moment, which is good. But we are going to need to do other X-rays. Okay, but I'll get an interpreter, a Spanish interpreter. Won't be long.
Jennifer had been fit and healthy until she was diagnosed with coronavirus on August 7.
I'd like to ask Jennifer, does she have any medical problems in the past?
And it's during the second week of infection that the real problems start to arise for patients.
I'd like to do a CT scan, a CAT scan. I just need to find out what's the cause of the chest pain and shortness of breath. We know that coronavirus can cause clots on the lungs, so a pulmonary embolism, and we also know that it can cause problems with your heart, and so that's why I'm looking closely at some abnormalities on a chest X-ray. So she's definitely going to stay in hospital. She is unwell. She's got a really fast heart rate, and you know, she's only 24, so this is exactly what we're talking about. This is why this disease is such a big deal.
For the Red Zone team, the pressure just keeps cranking up.
She's positive and the partner's positive, but I don't know any of this. This is all... The story changes every 5 seconds.
A couple of bays over, they're also dealing with a COVID-positive drug addict who's insisting on leaving the hospital.
So, we made a decision about if she does try and leave, that's this plan still. We're going to let her go, but we're going to notify the police.
Yeah.
And then...
Do you mind looking after this other lady who's coming in?
Emma is informed a heavily pregnant woman who they fear might also have coronavirus is on her way in as well.
She has had an episode of pre-syncope today which caused her to fall and hit her head.
Yeah.
She's also got a temperature of 37.8.
We've got a young woman who's pregnant who's had a collapse, and then she's had a period of loss of consciousness, and she's also got a slight fever, so it could be anything.
Running a temperature and with her COVID status unknown, the hospital takes no chances, and she's taken straight into the red zone.
How are you? My name's Emma. What's your name?
Welcome.
Welcome. Hello, welcome.
Being pregnant and infected with COVID-19 presents huge risks to both mother and child.
I've seen women who are coronavirus positive who are pregnant. The major risk is the low oxygen level in terms of the developing baby, and so if the mum's sick, the baby's sick, and that really puts the baby at significant risk.
Bookham will be swabbed for COVID-19, but the first priority is to assess whether any harm has been done to her unborn child. An ultrasound is performed straight away.
Haven't seen the fetal heart yet.
There's enough tension in the red zone at the best of times, but it's even greater when 2 lives are now at stake.
We can see your baby's heartbeat there.
How good was it to see the scan results that her baby was doing well?
Every time I have a pregnant woman, I just feel a sense of relief when I see the fetal heart rate, and you know, it was big and it was clear on the screen. Do you want to have a look? She was looking the other way, and I pointed her towards the fetal heart on the screen, and you can just see the look on her face, even behind a mask. She's just completely relieved. You know, having had 4 children, your life becomes about that baby that's in your belly. So, and that's what was going on for her.
In tough times like these, how important is it to get some rare good news in those cases?
Yeah, it's really important, and it's, you know, it brings you back to what humanity is. You know, it's about life, and you know, it's wonderful to see someone who's pregnant and the pregnancy's okay, and you know, it is good. You do have to remind yourself, let yourself be happy with the good stuff that happens at work. So we're just going to observe you for now, and we're going to get our obstetric colleagues to have a look at your baby.
Being a doctor or nurse has never been harder than during this pandemic.
The details out.
Okay, thanks for your help.
No worries.
They're not only looking after their patients, but they also need to be so vigilant when it comes to looking after themselves as well, with endless layers of plastic, perspex and rubber. What's the hardest part in terms of just your day-to-day job when it comes to wearing so much PPE?
There's the inconsequential stuff like just feeling hot and sweaty all day. That's hard. You can't go to the toilet easily. You can't take a sip of water. But the hardest thing, I think, is not being able to communicate properly with your patients and with the people you work with. We all kind of look the same behind the mask, and hopefully people can see this if they need to know where to find me and who I am.
Do you find that often you can try and comfort a patient just by giving them a smile, and that is completely gone now? It's completely gone. In the past, I used to think you could smile with your eyes, but it just doesn't cut it. There's so much in terms of facial expression that communicates so much to someone when you're trying to show that you care about them, and it's just gone. There's just so many layers that are there between you and the patient in terms of being able to connect and get a trusting relationship that in the past we took for granted. So a lot of the white bits here, they're all just changes that are related to the coronavirus, but there's no clot there, which is good. And so I'm now going to go and tell her. I still think you need to stay in hospital because you're unwell, but the scan is good. I can't see a clot. But literally within a matter of minutes, good news turns to bad for 24-year-old Jennifer. Her breathing's got a little bit worse, and she may end up needing some oxygen. Her condition suddenly worsens, and Emma decides she needs to be sent straight to intensive care. Do you have ICU beds? You don't have any? Okay. This lady needs to go to intensive care, and there isn't a bed at the moment. Right now, there's nearly 8,000 active coronavirus cases in Victoria, which is putting a monumental strain on the state's healthcare system and everyone that works in it. I've got one other problem. Yeah. And then there are the patients who refuse to help themselves. My COVID positive patient in bed 2 who's not complying with quarantine is trying to leave. All day, Emma has been dealing with a drug addict behind this curtain who wants to leave the hospital despite the fact they're COVID positive, putting the entire community at risk.
This is a really complicated case. Drug and alcohol problems are still rife, even in the setting of stage 4 lockdowns, and we certainly saw evidence of that today. So I had a young woman who was coronavirus positive, and she has a drug addiction problem. And that drug addiction problems means you don't adhere to stage 4 restrictions, and I'm sure that's going on, unfortunately, a lot.
They can do regular checks of her at home, but they can't force her into hotel quarantine.
Fine. If she's around people with coronavirus, she's infectious, and that then spreads to the next person. It's just that ripple effect that you just can't contain if you don't have people properly quarantining.
Coming up,
this is happening right now. This isn't something that's just on the TV.
the human toll.
It was terrifying. I couldn't even pick up the telephone.
Fighting for life
I cannot take air.
and confronting death
Aren't used to seeing people die on a regular basis.
in the COVID ward.
We can't be faced with wave after wave.
That's next on 60 Minutes. Right now, the streets of Melbourne are just about empty.
There are many dangers.
In contrast, though, the COVID ward at the Royal Melbourne Hospital is full. But beds are becoming available on a daily basis.
On this ward in particular, we've got someone dying almost every day at the moment. On this ward, people aren't used to seeing people die on a regular basis. It's not what they signed up for. It's not what they're prepared for.
Dr. Steve Mewy is an infectious diseases physician in the COVID ward, and he's just received news that one of his patients has died.
It's really disappointing. It's really quite challenging when people that you care for pass away. I think in particular because there are so limited treatment options we have for COVID-19 at this stage. We've got a lot of emerging evidence for novel therapies, and we're trying to do research and experiments that try to give us more options, but at the end of the day, it's very, very hard and challenging to see people die.
This is the brutal reality at hospitals across Melbourne right now. And for the first time, our cameras have been allowed in to show the human toll of this pandemic. Why do you think it's important that people see the reality of what's going on in there?
Well, I think it gives them some context to see that we're real people. We're doctors, we're nurses, the cleaners, the orderlies, etc. We're real people, and this is affecting us a lot. And I want people to know that this is real. This isn't something that's happening necessarily overseas only. This is happening right here in Melbourne right now. And I really want people to see that. I think that's a really important message.
First 2 days, I just thought I had a migraine. By day 3, I realised it was much more than that. But by then, I was just non-functional. I couldn't even pick up the telephone to ring the ambulance. So I lay there for 2 days before I could actually contact anyone, and that was probably the most frightening thing.
Joanne Poynton is a social work volunteer with the Salvos, a self-confessed clean freak who thought she'd done everything right to protect herself from the virus. But then it hit.
No, it was terrifying. I remember looking in the ambulance, and it was 1:45 on Sunday afternoon, and the next thing I remember is Friday night.
So more of a wheeze than a cough, is it?
No, I have a cough.
Yeah.
These are slow, cautious steps that Joanne is taking, but after a fortnight in hospital, she's finally heading in the right direction.
Oh, 90 again.
That's okay. You're working hard. Once we get back and you stop, it'll settle and it'll come back up. All right, my love, let me just check you one more time.
She wants to be a cautionary tale for the doubters out there, urging people just to do the right thing.
These people who talk about their human rights being stripped away by having to wear a mask, well, what about my human rights? I lost 10 days of my life. I almost lost my life. I was close to having a heart attack, you know? That's a bit of a higher price than wearing a mask.
Every morning here, they wait for the daily update on numbers, hoping they're heading down.
I've heard that there's 401 new cases in Victoria today and over 20 deaths.
But as our cameras were rolling on Wednesday, news came in of Victoria's deadliest day so far.
That's really disappointing working in the hospital because we're all waiting for a bit of respite. We're waiting for a bit of a break. We've been going for a long time now. We know that things are going to get worse rather than better for us if those numbers stay high, and that there's not going to be an end in sight without those numbers coming down.
Everyone's seen the headlines about this virus, but if a patient is wheeled onto your ward, the COVID ward, do you almost have to try and deal with the fact that they're just racked with fear?
Oh, look, absolutely. And you can imagine how scary it would be for them that they're in a COVID ward, they're in a hot ward, everyone around them is covered up, wearing PPE. You can barely see people's faces. You lose that human contact. There is a lot of fear. They can't be supported by their loved ones necessarily, and I think that makes it difficult. Just have to wait for that first door to close before the second one's allowed to open. So this patient also has been coughing up blood, and she's from an area with tuberculosis, so that's why she's in extra precaution. So this is what we call a negative pressure room, and so we've got extra layer of protection there. Hi, Rebecca.
Rebecca de Gomer is a 45-year-old woman from Papua New Guinea being treated for coronavirus. Her husband is upstairs in intensive care, also with COVID-19.
I just want to let you know that your husband is doing very well. And as you know, that they took the breathing tube out a couple of days ago.
God is good.
Oh, good. Rebecca is a unique case because she's got a couple of young children at home, and Rebecca's husband is also in the intensive care at the moment. So that's quite a big challenge for Rebecca to try to overcome because she's afraid. She's seen someone who's deteriorated very quickly, and she knows that there's a possibility that she may deteriorate. And so we need to try to do the best that we can to reassure her that we are there to support her, but we're also there for her husband.
Sounds like, yes, you're doing the work of a doctor, but you're probably being a counsellor quite a bit in there as well.
Well, that's right. Some people aren't necessarily concerned about their shortness of breath or their cough or their sore throat or their fever. What they're concerned about is what's going on with their children, who's looking after their husband, who's looking after the person that's at home, or who's able to support them once they're discharged.
Then there are people who are all alone, like 24-year-old Colombian student Jennifer Duque.
Pain in my chest. I cannot take air, and in general I feel pain in my body.
Since we first met her in emergency a day earlier, she's stabilised and is now in the COVID ward. She has to fight this all on her own. But in reality, everyone here does. Each patient is isolated from their loved ones as they fight for their lives. The only comfort 77-year-old grandmother Jennifer Devonish can get from her family is via Skype, sharing a song with her grandchild in Perth.
This is happening right now. This isn't something that's just on the TV. This is absolutely happening, and this is our reality at the moment. And I think one thing that's challenging for us is that sometimes it feels like there's no end in sight. We really want a measure that reduces cases to the point where we don't have to keep doing this, and we can't be faced with wave after wave after wave because it's like a boxing match. We can't go for round 3, we can't go for round 4, 5, 6 forever.
Coming up,
I'm young, you don't want COVID.
Medical advice.
I've lost my smell, I've lost my taste, it sucks.
From the experts.
The chest x-ray doesn't lie.
But will the sceptics? What's it like being that person who has to hold the phone while the patient says their last goodbyes to their family?
It's really sad.
Finally, get the message.
This is a real virus and it's deadly.
That's next on 60 Minutes.
Hey, my name's Dan and I'm a registered nurse that's been working throughout the Melbourne pandemic, and I've just been diagnosed with COVID-19.
Dan Collins is living proof that COVID-19 doesn't discriminate. Young and fit, he tested positive on August the 2nd. and has been documenting his battle on social media.
I mean, you don't want COVID. Some of the symptoms that I have, I've got a cough, intermittent fevers, sore throat, I've lost my smell, I've lost my taste.
The Royal Melbourne Hospital nurse is one of more than 1,000 healthcare workers in Victoria to have now contracted the deadly virus. He spent nearly a fortnight in hotel quarantine, during that period marking his 24th birthday, one he'll never forget.
I woke up feeling pretty bad. My heart rate was going pretty quickly. Walking to the door, for example, it was getting up to 140, which is pretty high, and it's getting short of breath on exertion.
You turned 24. If there were 24 candles on a cake for you, would you have been able to blow them out?
Not without coughing over it, I don't think. Yeah, I'm still pretty short of breath, and I've got this persistent cough, which I can't really shake at the moment.
Dan had been treating COVID-positive patients across several wards at Royal Melbourne, so saw each day how debilitating it can be for sufferers and how quickly those patients can go downhill. What's it like being that person who's in the middle and has to hold the phone while the patient says their last goodbyes to their family?
Oh, yeah, that was the moment that really struck me. And it was so sad. Just hearing like this patient's daughter say, "I love you, Dad," as she cried, and he couldn't reply because he was just so exhausted he couldn't talk. But he was crying as well as I held the phone to his face. And so they were just trying to say their goodbyes. It was really sad, really sad. Trust me, I've got COVID, I'm young, but it sucks.
Dan never expected his personal experiences to be shared with so many people, but his videos now clocked up nearly 1.5 million views. It struck a chord with the public as well as his colleagues.
There's a heightened level of anxiety when you're looking after someone you know, and it is tougher than normal, and it does affect you emotionally. You hate seeing someone that you're normally mucking around with at work, high-fiving, having a great time with, you know, someone that you value, and then suddenly they're unwell in front of you. So that's really tough. It's really personally challenging. 97-year-old short of breath with full crackles, yep.
Dr. Emma West has twice as much to worry about when it comes to infection. Both she and her husband Daniel are doctors at Royal Melbourne Hospital. Daniel is my brother, and Emma my sister-in-law. And I caught up with them both back in March when it was becoming clear they were heading into the eye of this storm. Are you worried for him?
Yeah. But I think, you know, this is what Em does and what she does well, and I think that she'll be the right person to be at the front line.
You worried for Dan?
Yeah, I don't want Dan to get sick. I just don't. That'd be hard.
Do you feel that same sense of caution each day still?
Oh, each day, absolutely. So I'm really meticulous with my PPE, but occasionally a thought will creep into your mind, and it can really rattle you. And I've certainly had times where I've just broken down with emotion, really, just thinking, oh my God, did I do that wrong? And am I putting my family at risk? And there are times where you just think, is this the day that I've exposed myself to the virus?
And then I needed doing.
Emma and Daniel have 4 kids, all in school.
Every day.
And what can sometimes be forgotten when talking about health professionals during this pandemic is they're dealing with just as much stress at home as they are at work. As this has got worse, have there been any times where the kids have sort of sat down with you or Daniel and said, we're really worried about you?
Yeah, they have. So Maggie, our 11-year-old, a couple of times has been pretty freaked out by coronavirus. I think the kids are more worried about us getting sick and us being gone, I think. And, you know, that's a legitimate worry. So we just really talk to them honestly about it.
Emma's message to her kids is the same as she gives to everyone. We will get through this. And while she and her colleagues are working day and night to save lives, ultimately she believes it's up to the community to stop this virus in its tracks.
We don't have much to fight this virus, but social distancing, masks, adhering to the regulations as they stand, that's all we have at the moment. You know, if ICU's full, ICU's full, and that's just, you know, the reality of the burden on the health system of this virus. And I don't understand the conspiracy theories around this virus. It is real. I'm seeing it every single day. The chest X-ray doesn't lie. The oxygen levels don't lie. This is a real virus and it's deadly.
Hello, I'm Sarah Abo. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9Now app for full episodes and other exclusive 60 Minutes content.